Well, when it comes to matters of the heart, it's not always easy to open up. I'm talking about open heart surgery, which is a very invasive heart procedure. And some experts have actually been working on a device they say is a better way to treat certain heart conditions. For more on this, I'm joined by Dr. Mehmet Oz, host of the Dr. Oz Show. Welcome.
Good to be with you, Angie.
So talk to me about the heart surgeries, the new world of heart surgeries, and what's changing now, what the new technology is providing.
So when I finished my training many years ago at Columbia University, I was sent around the world to see some of the great centers. In fact, I trained in Toronto, where I am right now, with Tyrone David. I learned a lot about how people think about dealing with heart problems in a way that I wasn't used to. And that allowed me and many others in my generation to get innovative. And in particular, when you look at the opportunities now, not just in heart care, but in cancer care and autoimmune diseases, we have wonderful advances that are being made. I was honored to be involved with writing the patent for the devices that we now use to help repair mitral valves. That's the valve in the middle of the heart that we can now fix without having to open the chest. And this recent clinical trial that we're all following reflected the fact that when it was used in hundreds of people in this randomized trial, and you can see the clip here, the mitral valve is the one on the right, by the way, and it's normal now, but as the heart distends, you'll see that green flow of blood. That's leakage of the mitral valve. When you put a clip into the body from the leg, again, without opening the chest, and you see the clip now being positioned across the valve, you can open the clip, grab the leaflets, pull it together, and then deploy that little clip, a little piece of Dacron cloth-covered clip, repairing the valve. And that resulted in a reduction by half of the number of people, roughly, who are dying, and the costs by about a half. And that's the kind of advance we like.
Yeah, and less invasive, if you will, compared to sort of opening up the entire chest, and then you've got a patient that's, in hospital, for days, perhaps even weeks. So kind of take us back in terms of how this is now very different from traditional heart surgery.
Well, in part, this is an operation that was really most useful in people who are critically ill. People, you wouldn't clip their toenails, much less open their chest and stop their heart. So the ability to fix the valve without having to open the chest and stop the heart allowed the survival rates to improve dramatically. But again, you have to prove these theories are true, and that's what this recent trial was reflective of. And by the way, there's a similar device for the other main valve of the heart, where we replaced the valve with a stent. I was involved also with that endeavor. And again, innovative scientists advancing it in clinical trials also revealed that it has an advantage over traditional open heart surgery, the kind I was trained to do. And these are just emblematic of how we see medicine changing. We're becoming less invasive, less aggressive. In cancer, for example, we can look at the actual cells in the cancer and figure out their DNA. And then by knowing that, use lower doses of chemotherapy, less radiation, less aggressive surgery to give you a similar result.
And people are living longer and healthier. Incredible. This is amazing. Dr. Mehmet Oz, host of the Dr. Oz Show. A pleasure. Thanks for joining us here in Toronto.
Thank you very much, Angie.
You're welcome.